My name is Paige Hunter. I am a right-handed clinician. Today I am going to be utilizing the Anterior Sickle. I am going to be using this instrument on Sextant 5. Now this instrument is only to be used on the anterior teeth, and it is a supragingival instrument. I'm going to turn my patient's head, retract the buccal. I am going to keep the tip 1/3 adapted to the tooth. Go a little bit before the midline and begin. Going all the way up to the incisal edge. Again, I am going to start a little bit before the midline. Keep the face 60 to 80 degrees to the tooth surface. Make sure the handle stays parallel to the long axis of the tooth. Okay, I'm now going to do services towards, and I am going to be utilizing the 8 o'clock position. So I am going to make sure my handle is parallel to the long axis of the tooth. Make sure my tip 1/3 is adapted to the tooth surface. Establish my working end, and in my case, there is only one working end with the anterior sickle. I am going to go from canine to canine, services towards. This is a supragingival instrument, and if it goes subgingivally, it is only 2 to 3 millimeters. And I'm going to go all the way to the incisal edge. Making sure I am 60 to 80 degrees to the tooth surface, and I am starting just before the midline of the tooth. I am now moving on to the lingual surfaces. I'm going to have my patient chin down. I think that's the most I'm going to get it to move. I'm going to begin on that first canine. Again, I'm going to check my working end, and in my case, this instrument only has one end. The other side is blunted. Going supragingival, because this is not a subgingival instrument. Keeping the face of my instrument 60 to 80 degrees to the tooth surface. Keeping my handle parallel to the long axis of the tooth. I'm now going to be doing the angles in clock position 8. Surfaces towards. I'm going to be starting on that canine, establishing my working end. So I'm going to start just before the midline. This is a super gingival instrument, working until that incisal edge. Keeping my face 60 to 80 degrees to the tooth surface. Keeping my handle parallel. Rotating into the proximal. Keep my tip 1/3 adapted to the tooth, into that proximal space, up into the incisal edge. And that's it.